We promised you we'd be visiting with Darinda Reberry. It's now Darinda Dick. Congratulations on that, by the way.
Thank you very much.
About what's going on at the hospital right now. Darinda's the CEO, President, Western Missouri Medical Center. And I guess everything's very fluid right now. It just changes minute by minute and hour by hour, doesn't it?
Absolutely. We have to be even more agile than normal. I mean, we always say that we're a nimble organization, but right now the recommendations are changing and the situation changes literally unrecognizably every 24 hours.
And you're trying to keep up with that and pass it on to the people that work at the hospital. And also, I would imagine the doctors' offices are part of the hospital, aren't they?
Absolutely. They're an integral part of our system. And that's mostly, there's a bunch of updates that I really want to share with the community. I did meet with our med staff this morning, so all of our physicians came for a meeting, and that we are allowed to do that. Business operations are exempt from the 10-person rule. But we did have a meeting this morning to discuss a lot of our plans and make sure that the physicians had adequate input and how to best care for their patients, and so they get to make a lot of the decisions around what care we're going to be providing, those kinds of things.
Yeah.
So I want to make sure that people understand we have a couple of kind of big things really rolling out today. Number one, we have decided to go with some of the recommendations from Missouri Hospital Association, American College of Surgeons, and so we will be evaluating all of our surgical procedures to make sure, is this something that this patient can wait on? Is this something that they need for diagnostics or treatment? And so the physician is working on looking through those schedules and seeing, and then calling patients and talking about, is this something we can wait 3 months?
You're talking about elective surgeries?
Elective surgeries, but sometimes elective surgeries still are diagnostic, still are to treat pain or those kinds of things. So we will still be doing some. It's really about the doctor's discretion, and so they all want to be as careful as possible. Really, just again, only to keep people in line with the social distancing, so not bringing them in harm's way or spreading something to the hospital at this point in time. So we know we're not at the worst yet. The worst is yet to come, as you've heard everywhere, but we want to make sure we're taking care of patients the right way, and so we are going to be looking through those things. At the same time, some other services around the hospital, we're doing the same types of things. So very elective screening radiology exams. We're going to be calling patients to reschedule those. At this point, I think they're saying April 15th, and then we'll obviously reevaluate that just like everybody else is doing. So we'll be doing that. We have had some continued changes to the entry to the facility. So just like all other healthcare facilities, we are limiting the number of non-essential people in the building. And so visitors are considered non-essential people. And so we have made the decision to go with the recommendation that most hospitals are doing. So starting at noon today, we'll be restricting one caregiver per patient. Now that's a patient that's in the bed, an inpatient, or an outpatient that's coming for a radiology exam. So one caregiver. So if you don't need a caregiver, please don't bring somebody. Okay. Come by yourself, use FaceTime, those kinds of things to talk to people. But obviously people need one caregiver if they're coming for any kind of procedure or those kinds of things. And I always am very family friendly to an inpatient stay for families. And so one caregiver, so you'll have to declare your
Somebody
caregiver.
Can stay in the car when somebody comes in.
They can stay in the car. So if they come to our door with a patient in radiology and there's two people, we will only let one person come through with the patient. Obviously, you still have to meet the right screening criteria. So if you have a cough, cold, fever, you're not going to get through if you're a visitor. And so we're just trying really hard to make sure we keep everybody safe and push this off as long as we can. That really is the, if you've read anything on the internet or watched TV, you know that the theory of flattening the curve is really what we're all about. And that really is, just like I talked about last week, we have to have enough resources to care for these patients. And if it exponentially grows too quickly, we won't have enough resources, meaning equipment, ventilators, people, beds, those kinds of things. So making sure we are just limiting the number of people that come into contact with each other. So the visitor thing is happening today at noon. So there are some door closure things. You'll know which we will put onto social media and be releasing some memos about those doors, but basically the front door on the west side will be closed.
The so-called main entrance?
The main entrance, that door will be closed as of noon today. If you are a rehab patient or a wound center patient, we're going to have special instructions for them because they have mobility issues, and so we have a plan for them. But every other patient will be coming through the east outpatient entrance and the ER entrance. So
Okay.
those will be the two entrances.
Okay.
We're making some significant plans for the clinics today. This involves calling patients to screen them, register them over the phone. So we should be calling you and saying, hi, the doctor's decided you really do need to come today. You know, we're confirming all those appointments as well. And we'll be registering you for your visit. We will want you to, when you arrive, to stay in your car and call us. And we have a special number coming out. We're working on all these logistics right now. And so you can text or call us that you're there. When the nurse is ready to take you straight back to a room, she will call or text your phone, what modality you want, and then she will meet you at the door and escort you straight back to the exam room.
Now, this is where? At the hospital or
This
doctor's
is the
offices?
clinics. This is doctor's offices.
Okay.
So this plan is coming out. It's not in force yet, but again, we're trying to empty our waiting rooms. We don't want people waiting around with each other. We don't want sick people waiting with each other or infecting anybody else. So we're trying to limit that. So the best case scenario is people waiting in their car. We think that it will make people feel more comfortable anyway if they can come straight back and go straight to the room
There you
where
go.
we have all the procedures for cleaning in between patients and those kinds of things. So that is coming out today. That is very significant for the flow in your physician office. So working on that. The other thing that they're doing is we're standing up virtual visits. So by the end of the week, in the next couple of days, your physician, might be scheduling you with a virtual visit. So calling you and saying, hey, you know, Dr. Glover really wants to see you because he wants to talk to you about your diabetes management. And so he has this capability to do this over the internet. And so we have a secure company that has a secure connection. And so he could get on the laptop, you could get on your device, and you guys could have your visit that way. This is common practice in some sick, quick type of care across the country, but this is something that people are moving to so that people don't have to get out of their homes to see and talk to the doctor.
Okay.
So that is coming. I mean, lots of things. Before I move to probably the most important thing, we have worked really, really hard on the surge plan. So you'll hear that there's not enough beds, there's not enough healthcare workers for patients going into this. So we have worked, on a plan for, number one, diminishing exposure to healthcare workers if a patient comes in that's potentially positive. So we have worked through what that looks like. Where would we put patients if we have more patients than we have beds available? And so we have full plans surrounding those things. So I want people to feel reassured that we have really worked on that. And this will go so far to include physician help, as your physician doesn't go to the hospital anymore, but if we need those physicians to start caring for patients in the hospital, what kinds of rotations and how do we use them in this emergency type situation? So everybody's on board. I want you to know that your medical and healthcare community is really dedicated to taking care of the needs for this. I've really seen people pull together, and it's been really amazing to watch them.
Yeah.
And so we are ready. And
Your days are getting long, aren't they?
the days are very long right now. Probably the most important thing that we want to communicate, and this is very fluid, and we are implementing this. The plan is this afternoon. So we are opening an evaluation and testing center for COVID possible patients. So we, like the tents that you've seen on all of the news and those kinds of things, we've worked with our medical staff to develop a process using our express care where we will be stationed outside, and your doctor, so if you are being seen for cough, cold, fever, if you call your doctor and say, hi, I'm a patient of Dr. Glover's and I have a fever and a really bad sore throat, they will advise you to go to this evaluation and testing center where then you'll be tested for flu, strep, and then COVID if those are negative. So we do have that capability, and we're going to be advancing that capability just like they're saying in the news. So we will be moving forward with some other private vendors. The private vendor that we are using today, and I say that because this is only for today, the quarantine that you would be sent home with is 3 days to get the result. But there are some private vendors that we're trying to work with that have a 12 to 18 hour turnaround. And so we're not doing this to make people scared. We don't want people to be scared. Please do not rush the Express Care parking lot this afternoon and think that you need to be tested, I want you to call your physicians first, because the physicians are the best people to say, yes, you need to be tested, or, okay, you don't have a fever, why don't you stay at home today? And then, if you get a fever tomorrow, we'll take you tomorrow. So please use that. We are ready and poised to have more people answering the phones. Everybody, we're not doing anything else at the hospital but this. And so
this is it. Huh?
This is it. And so we have lots of people that are ready. Right now, we're all well. None of us are sick. And so we will be answering the phones and we'll be helping. So don't flood the parking lot. But if you don't have a doctor, you can still go to Express Care. And if you are, and then they will treat you. That's why we're calling it an evaluation and testing center, because we actually will have a provider. Some of those tents you see are just lab personnel taking samples. We actually will have an Express Care provider, and possibly some of our other providers, they're actually looking, we'll get you out into the tent. We will be all suited up. You're going to see us in those white Tyvek suits. Do not be scared. We're just trying to protect everybody. But they will be then able to assess you and give you the proper treatment, supportive therapy. Let's say they need to look into your ears, they want to listen to your lungs. So we will actually have a provider there, but the plan would be, if you are not to the point where you need some of those adjunctive therapies, that we would test you. We're going to test you in your car. We're going to try to minimize your exposure out, either both ways. So lots of things coming. This is a very early, half-baked communication, and I hate to say that on the radio, but we've been working on this plan for the last 18 hours, and so our plan is to stand that up this afternoon, and our physicians are very happy because we want to minimize these people. And when I say these people, it's us. We are all going to, this is going to be us. It's us.
Together,
it's us.
Yeah.
But we don't want everybody having to go to the physician office and, possibly contaminate or help. We are trying to do social distancing even in the practice of medicine. And so this is our way. Yep, it is tough. And so we've got a lot of smart people thinking about how to do this the safest way and for everybody. And I feel confident about our plan.
Is your plan, or is it coming with in cooperation with other hospitals and the CDC, or who?
We do follow the CDC guidelines, obviously, on testing criteria. The biggest thing that we're taking out based on our physicians' recommendations is we're testing really without the travel question, because it is our belief, based on some of the exposures that have been in local, the surrounding counties, that people have been exposed that potentially haven't had the travel criteria. So we are going to be testing on symptoms. That's based on the evidence and the things that are coming out of those other areas that are the most hard hit. Now, we are in close contact. I'm in close contact with Bothwell, Clinton, St. Luke's, HCA. We are all in close contact about what are you doing? Where are you going today? What have you been seeing? And so I think we're all very consistent on our visitor policy, door closure, our elective surgery. I mean, we're all doing the same types of things, and it's all based on recommendations from CDC, but other places too, like the American College of Surgeons, Missouri Hospital Association. So we are following those recommendations, and then also just trying to use what feels right. So our physicians are like, no, this is what our patients need. And so it's a combination of things.
Ventilators, you have enough of those if the need should be?
We talked at MedStaff this morning about ventilators specifically, and there are ways. They found this in one of the other outbreaks, and I honestly, it escapes me, but one of the other outbreaks in the country, they found a way to use one ventilator to ventilate 4 patients. There are ways to do different things if the need should arise, but we have people working on that, making sure that we have the right equipment.
Hopefully you won't need it.
The plan, I don't like to say hope, the plan is that we are really doing a good job to flatten this curve in our communities. Now, we need every community around us to do the same thing. I left Warrensburg last night after 8 o'clock, and it felt almost like Christmas, so good job, everybody. We really need to stay home if we can. And I've been in other communities that have not been as Christmas feeling, and so we really need, no matter if you believe this or not, or you think this is hype, please follow the recommendations and complain about the hype at home in your house, because this is truly an emergency. And it's an emergency because if we have the exponential growth of this disease in patients that has been shown in other countries and already here, I mean, this changes daily.
Yeah.
So if that exponential growth continues to happen, and people, and if let's say only 20% of them need supportive care in the hospital, that still will overcome the system that we have in place. And so we have to flatten this curve. We have to slow the spread. It is our responsibility. If we love those around us, older people, people with comorbidities, this is just what we have to do. Whether we believe it or not, sometimes you have to be a good follower. And this is that time.
This is it. And you will, of course, keep us updated here so we can pass it on anytime you have some of these changes. It's so fluid that you might need to pass on something in an hour from now. Whatever.
Right. I am working closely. There's a group of us here in Johnson County that's working with Emergency Management Agency. Obviously, the sheriff, we all got together. We're all in this group together. The Sheriff's Department, Rich Lockhart, the PD, UCM, Whiteman. We're all together on this, the health department, the hospital. And so we share communication several times an hour, actually, with each other. But they're, just this morning, our information officers from this group, so people like Rich Lockhart, Tara Carlisle from the hospital, they're developing some strategies to make sure we're communicating with the public to keep fear down and just some other things. And so you're going to see some things coming out, Facebook page for local members, for community members, so that they can follow what's going on. It may have some fun things. You know, the PD, they like to be funny, and I like to be funny too. So they will be providing some things to help give a little uplift to this as we're staying away from each other. And so I hope that everybody will take advantage of those kinds of avenues. But absolutely, we will be keeping people, it is changing daily. And so my number one concern is making sure my medical providers are communicated with the changes, but then my secondary is getting this group to know and the public so that we can make sure everybody is not fearful, but knows that we're doing what we can to keep us safe.
All right, Darinda. Thank you a lot for coming today again.
No problem. Thank you for having me.
Visiting with you some other time here about this. Darinda J, CEO, President, Western Missouri Medical Center.